Welcome back to VBuzz. You're still here with myself, Shrita, and Jay Walia. And Dr. Sharad Ratna is here with us today to share his vast experiences in obstetrics, gynecology, reproductive medicine, and sexual health. He is committed to delivering the best of his medical expertise in women's healthcare. And so we're so pleased that he'll be helming a new monthly series on VBuzz on all matters of women's health. Last month, we highlighted uterine fibroids, and this month, we move on to the topic of perimenopause. Welcome back to the show, Dr. Sharad.
Hi, extremely thrilled to be back on this very controversial topic.
Oh.
Yeah, we're discussing a topic that, more often than not, a lot of women don't want to discuss.
Yeah, they want to shy away from it.
They want to shy away from it. But what is perimenopause exactly, and when does it occur, doctor?
Okay, the perimenopause can be interchangeably used with the term climacteric and menopause transition. It's a variable period of time prior to the menopause. So peri means around.
Yep.
And menopause means the last menstrual period. So the menopause is actually the last menstrual period 1 year later. Okay, after 1 year.
Yep.
So there is a variation in hormonal levels and fluctuation in cyclical hormones during this time. And it normally presents with irregular bleeding and symptoms of the menopause, in particular vasomotor symptoms and genitourinary symptoms.
And what are some of the biological changes that occur during the perimenopause stage?
In the perimenopause, it is marked mainly by irregular bleeding. So, irregular bleeding is very important in the perimenopause. It may signify bleeding due to the perimenopause, but it's always important to exclude other things that can also be pathological, such as early cancer of the lining of the womb or even early cancer of the womb. So we need to exclude other causes of irregular bleeding in the perimenopause before we say this is due to fluctuation in hormone levels and due to cyclical changes in the hormone leading to a decline in ovarian function. Okay, we are born with something like 6 to 7 million eggs. A female fetus at 20 weeks has 6 to 7 million eggs, and by birth it only has 2 million eggs. And at puberty, it is only left with 500,000 eggs. 99% of eggs disappear and die off. And throughout the whole reproductive cycle, that is from the time you have your first period to the last menstrual period, you ovulate about 500 times. So these are some fun facts I thought I'll share with you. So the vast majority of eggs die. So by the age of 40, there's a dramatic decline in eggs. And this leads to the build-up towards the perimenopause, the menopause, and the postmenopause.
Yep, and these symptoms and all these signs of perimenopause are usually something that, are spoken about quite a bit. People mention this problem and that problem. What's the biggest problem that women face when they hit the perimenopausal stage?
Excellent. So, as I said, initially it's irregular bleeding, maybe one of the symptoms. The vast majority of Asian women do not complain of vasomotor symptoms, which are things like hot flushes, night sweats, as much as Caucasian women. 80% of Caucasian women present with hot flashes or flushes, as Americans call it, night sweats, feeling very hot at night and things like that, irritable. 20% of Asian women present with, the vast majority of Asian women present with genitourinary symptoms, bladder symptoms, irritable bladder symptoms, wanting to go to the toilet very often, pain on passing urine and things like that.
Is there a prevalence of urinary tract infections as well for Asian women?
It's actually not urinary tract infections, it's cystitis. It's just an irritable bladder. There's a big difference between the two.
Doctor, earlier you mentioned one of the symptoms is, of course, irregular bleeding. And how long does this irregular bleeding period usually last for?
Yes, it's very unpredictable. There isn't a cutoff time. We don't really know what the onset and duration of this may be, but it usually occurs around the age of 47, 48.
And you mentioned earlier, it's very important to kind of distinguish it from the signs of early cancer. How do we really exclude that from...
Excellent. So you need to visit a gynecologist, obviously. Transvaginal scan is needed to look at the lining of the womb, and a biopsy of the endometrial lining is necessary. To have a histological diagnosis before you can say this is perimenopausal bleeding due to hormonal changes. The other thing is a pap smear is obviously needed, you know, during this examination. Yes.
Okay.
And you mentioned just now a little earlier that, you know, a woman must not have gotten her menses for about 12 months. Is this the standard criteria when determining the onset of menopause itself from
Yes,
perimenopause?
menopause is defined as 12 months after the last menstrual period.
All right.
And how would we really know if the bleeding is normal or not, other than going to the doctor and getting a biopsy?
Yeah, of course, the bleeding presents in a variety of different ways. It may be shorter cycles and longer cycles, leading very heavy bleeding and clots and flooding.
Yeah.
That's due to the anovulation, where the egg is not released. Exclusion by histological diagnosis or direct visualization of the uterus and hysteroscopy is necessary.
And would you say, doctor, that it's very important if you are going through these kind of symptoms to distinguish the two, or is it kind of safe to let the symptoms go on for a few more months? Or
Okay, so if you're not complaining of irregular periods, you're complaining, in the majority of cases, you're complaining of vasomotor and genitourinary tract symptoms, then obviously, you know, if it's troubling you, it's affecting your quality of life, then you should seek help. There are remedies that can be helpful in improving symptoms, in particular in the first few years of the menopause. If initiated early, you may improve your quality of life tremendously.
And are there different stages to perimenopause, you know, or is it unique to the individual woman itself?
Yeah, I mean, interestingly, the perimenopause can be divided into the early and late stage. In the early stage, you'd have irregular bleeding, you know, but in the later stage of the perimenopause, you may have actually missed periods of more than 3 months, and then sometimes even leading to heavy, prolonged bleeding.
And of course, all these symptoms, you know, are not something that is very comfortable to live with, you know, hot flashes and the irregular periods, you know, it must come with some sort of discomfort. Are there any natural therapies that one can kind of employ?
Yes, I think the first thing is a holistic approach, like anything else so far we've spoken about. Balanced diet, regular exercise, you know, avoiding alcohol and smoking, all these things, stress management. Plus, you know, there is some evidence to show the benefits of phytoestrogens, like soy-based isoflavonoids, red clover, black cohosh, and things like this. These are all natural remedies, but the evidence is not conclusive or consistent.
And do these natural remedies ease the symptoms, though?
They may in some, they may not in some.
And apart from that, are there any medical treatments that one should seek out?
Okay, of course, the dreaded word hormone replacement therapy. There have been lots of controversy in the press. There have been bad press, and there's a taboo and destigmatization of this term. But the consensus now is that if started early in the menopause for a very short period of time, may in fact bring about long-term benefits. In particular, improving symptoms, vasomotor symptoms, genitourinary tract symptoms, and also it affects, most importantly, we haven't spoken about, it protects against osteoporosis and even, you know, dementia, Alzheimer's dementia. But I'm not talking about long-term therapy. I'm talking about just short-term, just during the initial phases, just to improve the symptoms. In the first 1 or 2 years when it's worst.
Okay.
And would you say that, you know, hormone replacement therapies or HRT is recommended? I mean, is it right to sort of delay the menopause itself?
It's not recommended because of the bad press. But you know, doctors are very
when is it necessary?
Wary. If the symptoms are affecting your quality of life, you know, tremendously. You know, there's this whole cycle of hot flushes, not sleeping well, having anxiety, depression, and then this may coincide with the time that your kids leave home. You know, it's a very difficult time, and it's affecting your quality of life. It's not, you know, it doesn't allow you to concentrate at work or go about your daily life. Then a trial of, you know, a non-hormonal method may be initially, you know, used, but.
Are there any risks, though, with hormone replacement therapy?
I mean, it's a lot of controversy surrounding this, but it's generally contraindicated in someone with personal or family history of breast cancer. And you know, and current advice is to use it less than 5 years. If possible.
Now, we've been speaking a lot about what happens when it actually comes to the perimenopausal stage.
Yes.
But what can we really be doing to prepare ourselves before perimenopause occurs, aside from the holistic approach?
Okay, some of the things you could do is, with hot flushes and
Yeah.
night sweats, wear lighter clothing, sit in air-conditioned rooms, have a fan ready, things like that. Avoid hot and spicy foods, common sense type of things.
Yeah.
Have a cold pack next to your bedside at night. Because if your sleep is affected, you're sweating, you feel very moody the next day, and that's a vicious cycle. And it gets worse as time goes by.
And what are
there's some therapies that you could try, non-hormonal things like clonidine, and even SSRIs, which are used.
And what is clonidine?
Clonidine is an antihypertensive drug that was used to treat blood pressure, and it's a vasodilator, and it shows that it can actually be used for hot flashes. Yeah.
Okay.
We often hear about the mental and the emotional impact, the perimenopause stage can have. Is it something that most women will experience similarly, or is it fluctuating and the likes of
It
that?
fluctuates. There's a wide variation in symptomology.
Is there a coincidence with the amount of hormones that's being depleted as well, with the fluctuations of emotional?
No, there's no measurable amount of hormones. There's a gradual decline, and every woman has a different set of symptoms.
And apart from changes in the daily living habits, are there also supplements that could really ease the symptoms or that are needed?
Supplements?
Yeah.
Okay. Supplements that come to mind would be definitely vitamin D, calcium,
Okay.
vitamin A, C, and E. Whether they relieve symptoms or not is a different issue. They're needed. Calcium and vitamin D in particular in the prevention of osteoporosis. 200 million people worldwide suffer from osteoporosis, and it's by the age of 60, 1/3 would have had a fracture of somewhere of the wrist, of the hip, of the vertebrae. So prevention of osteoporosis is
So you mentioned
important.
the word prevention. How early should we be employing these preventive measures and taking supplements and all that? Is it maybe a few years before the onset of perimenopause? Or?
I think you should be doing it all the time.
Oh,
You should be fit and healthy all the time.
All right, as well as taking the supplements all the time? Or?
Supplements, obviously, after the age of 40. Yeah.
Okay.
Of course, with the onset of perimenopause, there isn't exactly a time that it's supposed to arrive.
Yes,
There's
that's
a range of time. So
Yes.
in terms of a slightly early perimenopause,
Yes.
could that actually be an indication of underlying health problems?
Well, an early menopause or perimenopause is very rare. Something that's less than the age of 40. It's called premature ovarian failure. And we don't really know what the cause is. It may be genetic, it may be infective or immunological. And if it does occur, then it needs to be managed at that point in time. It's very rare, less than 1% of cases.
And, does going through the perimenopausal stage really make you more susceptible to other infections or diseases or any kind of ailments?
The menopause per se would make you more susceptible to cardiovascular disease and osteoporosis and dementia in the future.
Okay.
So it's all part of aging. That's one thing. And second thing is estrogen has a protective effect. Men have heart attacks more than women before the age of 50. After the age of 50, women have more heart attacks than men.
Oh, because the estrogen levels
because
decrease.
estrogen is protective, not only in the bone, the heart, and the brain. And the more heart attacks, more strokes, and the metabolic syndrome,
Wow.
with obesity coming in, and that causing all of these things
Wow,
to
that's
suddenly
not
explode.
looking too good for women
All
compared
these-
to
And men, I
men.
think, and
Underlying
Okay.
problems as well. But just being around my female relatives and just hearing them talk, you often hear this adage that, if you just look at your other female relatives around when did they experience perimenopause. And you too, I hear them telling that to my cousins. Is that true though?
Yes. I mean, you could use that as a guide, but every woman is different.
Okay. So would genetics play a part for around the time when a perimenopause is supposed to occur?
It may play a part. Yes, it may play a part, yes.
Okay, so is there any other advice out there for women who are really struggling with going through the perimenopause stage and menopausal stage?
Yes, don't go through it alone. Seek some advice.
Yeah.
Because if you're really very apprehensive about going on hormone replacement therapy, there are other simple remedies that may be possible, may be available.
Yeah.
And before you go on to slightly more, hard stuff.
Yep.
Okay.
And what's the spouse's role in this, in easing the transition?
Very difficult. No, patience, tolerance, and support.
Okay, you know,
alright.
just being there for your
Yes,
loved one.
yes.
Thank
Lots
you
of
so
tender
Thank you
loving
so
care.
much.
Thank you so much.
A
Great to
lot
be
of
back.
TLC right there. Thank you
That's
so
right.
much, Doctor.
Okay. Thank you so much.
Lots, very, very insightful
Yeah, so you know, the
interview
most
right
important thing is to remember you're not in it alone.
And of course, guys out there, you ought to know stuff like this as well, because you can be there for your loved one, and
Yeah.
you know, it just makes the transition a lot smoother.
Yes.